What are the long-term outcomes for patients with adrenal cancer who undergo surgery? Are there any emerging treatments or therapies that might improve my chances of survival? Yes, so adrenal cancer, or another name for it, adrenocortical carcinoma, is a very challenging disease. Unfortunately, first of all, only about a third of patients when they first diagnosed have disease that's localized to the adrenal gland. The other 2/3 of patients, the cancer has already spread elsewhere, most commonly to the lung and to the liver. And surgery in that scenario up front is not possible. But let's say the adrenal cancer is confined to the adrenal gland, then surgery is the best option and the only curative option. And when we continue to study and do a lot of scientific studies, and we've done a lot of genetic research trying to understand what's the molecular pathology, meaning what are the genetic changes that makes a normal adrenal cell turn into a cancer. And what we do know for adrenal cancer is that it's very heterogeneous. So what that means both genetically and practically is that each patient is very individual. So you have some adrenal cancers that you do surgery and they are cured and they do very well. Unfortunately, that's a minority of patients. The other type of patients, you do the surgery and unfortunately the cancer may come back with liver metastasis or lung metastasis or so forth. So it's a very aggressive cancer, but the only potentially curative treatment is surgery. There certainly are emerging treatments and therapies. One medication that's been used very, very long is mitotane, but it's a tough treatment for patients. There's conventional chemotherapy, but there's more novel, what we call tyrosine kinase inhibitor, which is a more targeted therapy that's being used. And thirdly, there are some clinical trials. So for patients that have adrenal cancer that's spread elsewhere, it's not a bad idea to go on clinicaltrial.gov, which is the NIH, NCI, National Cancer Institute's website that tracks all the clinical trials, and this is updated on a very frequent basis. So whenever there is a clinical trial anywhere in the world that where either phase 1, phase 2, phase 3, where they do studies on patients with adrenal cancer, it will show up on that website. So that's a great resource.